High blood pressure can quietly damage the body for years before a person notices anything is wrong. That is what makes hypertension so dangerous. Many people assume they would feel it if their blood pressure were too high, but high blood pressure often causes no clear symptoms at all. A person may go through a normal day and feel completely fine, while silent damage is building inside the body. That is why hypertension is often called a silent threat. Blood pressure is the force of blood pushing against the walls of your arteries. Every time the heart beats, it sends blood through those vessels to deliver oxygen and nutrients throughout the body. That pressure is necessary for life, but when it stays too high for too long, it puts extra strain on the arteries and on the organs they supply. Over time, blood vessels can become less flexible, narrower, stiffer, and easier to damage. The heart then has to work harder to move blood forward, and when that burden continues for years, the consequences can be serious. High blood pressure raises the risk of heart attack, stroke, and heart failure. It can also damage the kidneys, affect the eyes, and contribute to long-term brain and memory problems. So even though hypertension may feel invisible, its effects are very real. One of the biggest mistakes people make is waiting for symptoms. They think, I feel fine, so I must be okay. But feeling fine is not proof that blood pressure is healthy. Many people first discover they have hypertension during a routine checkup, before surgery, at a pharmacy kiosk, or after checking at home. That is why measuring blood pressure matters. You cannot guess it accurately. You cannot rely on how you feel. You have to check it. In general, a blood pressure reading of 130/80 or higher is important, but one number alone does not tell the whole story. Blood pressure can shift during the day. Stress, activity, pain, caffeine, and even talking during a measurement can affect the result. What matters most is the pattern over time. A single elevated reading may need to be rechecked. Repeated high readings deserve attention. Persistent elevation deserves a plan. Some people have a higher risk because of family history. Genetics can influence how the body regulates blood pressure. Age also plays a role because blood vessels often become less elastic over time. But risk is not determined by genetics alone. Daily habits matter a great deal. What you eat matters. How much you move matters. Whether you smoke matters. How much alcohol you drink matters. How well you sleep matters. How you manage stress matters. And conditions such as diabetes or kidney disease can make blood pressure harder to control. Let's start with food. One major factor is sodium, which is found in salt. Too much sodium can cause the body to hold on to extra fluid, which can increase pressure in the blood vessels. Many people think only the salt shaker is the problem, but much of the sodium in modern diets comes from packaged foods, canned soups, instant noodles, processed meats, fast food, sauces, and ready-made meals. That means a meal can seem normal and still contain far more sodium than expected. The answer is not to make eating miserable. The answer is to become more aware. Choosing foods lower in sodium,
A body that rarely moves tends to make blood pressure control more difficult. Regular physical activity helps the heart and blood vessels function more efficiently. It does not have to mean intense workouts. For many people, a consistent walking habit is one of the most practical and effective places to begin. A brisk walk most days of the week can help. Taking the stairs more often can help. Breaking up long periods of sitting can help. The important thing is not perfection. The important thing is consistency. People often delay change because they imagine they need a perfect diet, a perfect gym routine, and perfect motivation. But health rarely improves that way. It improves through repeatable actions that fit real life. Body weight can also affect blood pressure. Carrying extra weight often makes the heart work harder. The encouraging news is that even modest weight loss can make a difference. Smoking is another major issue. Smoking damages blood vessels directly and increases cardiovascular risk in multiple ways at the same time. If you smoke, quitting is one of the most powerful steps you can take for your heart and blood vessels. Alcohol can matter too. Heavy drinking can raise blood pressure and interfere with overall health. Cutting back can support better control. Then there is stress. Stress can affect the body, shape daily choices, worsen sleep, increase overeating, lead to more alcohol use, and make healthy routines harder to maintain. That is why stress management is not a luxury. It is part of prevention. It is part of treatment. Sometimes stress management means deep breathing. Sometimes it means getting outside, stretching, praying, meditating, journaling, counseling, or protecting time for rest. Sleep also deserves more attention than it usually gets. Poor sleep, short sleep, and sleep problems can all work against blood pressure control. Better sleep is not just about energy, it is part of cardiovascular health. Now, here's the good news. Hypertension is serious, but it is manageable, and in many cases, it is partly preventable. That means people are not helpless. There are steps that work. There are routines that protect the body. There are tools that can show progress, and there are treatments that can reduce risk. One of the most useful tools is home blood pressure monitoring. Checking blood pressure at home can give a clearer picture of your usual pattern. It can also help you see whether lifestyle changes or medication adjustments are helping. To get a more accurate reading, sit quietly for a few minutes first. Keep your feet flat on the floor, support your arm at about heart level, use a cuff that fits properly, and keep a record of your readings so you...
And hypertension is not only a concern for older adults. It can affect younger adults as well. That is why prevention and screening should not be delayed until late in life. There are also situations where urgent care is needed. If someone has chest pain, severe shortness of breath, fainting, signs of stroke such as facial drooping, arm weakness, or speech trouble, or other severe sudden symptoms, that needs emergency attention. But for many people, the most important moment is not the crisis. It is the ordinary moment. The ordinary moment when they decide to check their numbers. The ordinary moment when they choose a lower sodium option. The ordinary moment when they go for a walk. The ordinary moment when they refill a prescription instead of putting it off. The ordinary moment when they keep a follow-up appointment. That is how prevention and control are built. Not through fear, through repeated action. Think of blood pressure control as a long-term investment in the organs you cannot afford to lose. Every healthy routine is a deposit toward protecting your heart, your brain, your kidneys, and your future. And progress does not need to be dramatic to be meaningful. Steady progress counts. Ordinary progress counts. A few points lower can matter. A few healthier routines repeated each week can matter. So if your blood pressure has been high, do not panic. Get informed. Get measured accurately. Track the pattern. Work with a clinician. Build habits that protect your blood vessels. Take medication if it is prescribed. Stay with the plan long enough to let it work. And if your numbers are normal right now, do not ignore them. Protect them. Prevention starts before damage begins. The habits that prevent hypertension are often the same habits that help control it. Less sodium, more movement, better sleep, no smoking, smarter food choices, stress management, routine checkups, and consistent follow-through. Check it, track it, treat it. Stick with the plan. Hypertension is serious, but it is manageable. The earlier you act, the more you protect. So, start today. Know your numbers, take them seriously, and give your heart, your brain, your kidneys, your eyes, and your future a safer path forward.